to our channel. My name is Dr. Anita Raja. I am a women's health specialist with a special interest in longevity and lifestyle medicine as well. I also have a special interest in sexual health. With me today, I have Dr. Sidra Hassan. So, Dr. Sidra, tell us about yourself.
Thank you for having me today, Anita. My name is Dr. Sidra Hassan. I'm a GP and I have special interest in menopause, contraception, and psychosexual medicine. I also like to know a little bit more about lifestyle medicine.
Fantastic. And as promised, we are doing a series of podcasts around women's health. And today is the episode number 2. And the topic of interest, because you've sent us lots of requests, is oral contraceptive pills. So, Dr. Sidra Hassan, how many oral contraceptive pills are out there?
So, this is one of the most commonly asked questions. There are two types of contraceptive pills, the combined pill and the mini pill.
And what's the difference between them?
So, as it says in the name, the combined pill is a combination of two hormones named estrogen and progesterone, whereas mini pill only has one hormone called progesterone in it.
Okay. And if a patient were to come to you in sort of, your clinical practice, how do you decide which pill to prescribe to the particular patient?
So we look at the family history, we look at the history and what patient likes, because sometimes girls would like to have a period, some girls would not like to have a period. So we ask a series of questions, and then we also look if there are any contraindications, and then we decide. We actually help girls decide or women decide what is the best method of contraception for them.
And Dr. Sidra, if I'm not wrong, there is a new medication now, which is a new pill on the market, which is a, progesterone only pill, but it actually gives you a period as well. Is that right?
That is very true. So traditionally, combined pill, women will have a period every month or every 3 months, depending how they take it, and it gives a very good bleeding control as well. However, there are some contraindications. For example, if you have a migraine with aura, if you have clots in the legs, or if you are obese or if you smoke, this might not be the best option for you. On the other hand, the new pill that you have mentioned, it's called drosperidone, or it has a trade name of Slind. So this only has one hormone called progesterone, but the good thing about this is it has good bleeding control. And there are 24 active pills and 4 inactive pills, and girls tend to have bleeding on these 4 days. So it works well for the girls who would like to have progesterone because it only has one hormone, but also do not want to have the unscheduled bleeding side effect of the rest of the progesterone medication. So this is for them.
And Dr. Sidra, if a patient were to come to you and they had like skin problems, for instance, they have like breakouts, acne, which are incredibly common whilst you're a teenager, what would you sort of prescribe for them?
So there are certain medications, for example, Yasmin, which is more for the girls who have acne problem. But some girls can have it varies. Some girls will have acne with some of the medication, so we can always try one and then move on to another type of pill to see if it works better for them.
And how long would you give before you sort of decide on reviewing the pill?
Generally, we prescribe it for 3 months,
Okay.
and then we would like to have a review to see if there are any side effects. And we also like to have an annual review to see if the pill is the right choice for them and if it is still working or if they have developed any new contraindication. And if they are on a combined pill, then we also like to check blood pressure and their height and weight to make sure that the pill is right for them.
And the oral contraceptive pills, are they just used for contraception or are they used for other sort of medical indications as well?
Now, there are more indications than contraception, especially if you have if you have heavy periods, or if you suffer from bleeding during your periods, or if you feel fainting. So there are also benefits for that.
Fantastic. In the end, is there anything else you want to add before we go?
I would just like to say, so you can always start from one type of pill if you're unsure, and then move on to another type of pill. And your doctor can always help you decide which is the best type of pill for you.
And again, like we said in the beginning, one size doesn't fit all. So it's very important that you speak to your clinician. None of this advice we've given you is medical advice. You must speak to your GP before you decide on the pill that you want to continue with or commence. But these are just health and lifestyle tips that we're giving you, just educational videos to help you decide better. I hope you enjoyed this. Look after yourself. Please hit the subscribe button. See you again. If there are any other topics you want us to discuss, put them in the comment section. Bye-bye.